and welcome to our Gold Learning viewers. Welcome to the Gold Learning Online Symposium, Childbirth Education. I have the pleasure of sitting down today with Jennifer Kamel. Welcome, Jen. It's great to have you here.
It's great to be here, Fiona.
And we're just going to chat for a few minutes about Jen's up-and-coming presentation here at the Childbirth Symposium, The Ethics and Realities of Forced Cesarean Surgery. Wow, Jen, that is just quite the topic. I'm very excited to hear what you have to share with us, knowing that you're an amazing strategist and such a voice for so many. So I'm super excited to have you. So welcome.
Thank you so much. I'm excited to share all the information that I uncovered in preparing for this presentation. It's a lot of meaty, juicy, fascinating, shocking, and in some ways inspiring information.
Well, I wouldn't anticipate anything less from you, Jen, so why don't we get started? Why don't you start from the beginning and introduce yourself to our listening audience today, because I'm sure that they would love to hear a little bit about yourself personally, and then perhaps you can let us know why you're so passionate about this subject as well.
Well, my journey began when I had a C-section almost 13 years ago, which is hard to believe that I am now the mother of a tween, going through all the crazy and the joy that tweendom brings. But that's when my journey began, and I had a really hard time finding good information on C-sections and VBACs. That was back in 2004. And so I just started collecting information for myself. And then I found that a lot of other women were looking for that same kind of information. And they were tired of hearing generalities. They were tired of hearing conflicting information. And they were tired of being scared about what their options were. And what I found was that learning the facts was one way for me to mitigate my fear and joyfully move forward and plan my birth, because I understood what could happen. I understood the likelihood that that could happen. And I also understood how to make a plan in the event of XYZ happened, what would I would do. And that enabled me to pack away my worries and just move forward in my pregnancy and be excited and happy instead of full of worries and fear.
Well, that sounds wonderful. I love the language that you use right away, Jen. I can tell that you are such an articulate woman yourself, but what an importance that has had in the realm of VBAC, because we know that language today in any healthcare professional field is so important. But when it comes to VBAC, we're just still hearing so many negative things. And I loved what you said about, facts really get rid of fear, and they did for you. And that's how you got rid of some of your fear, was just pulling all of those facts together. Well, let me ask you this question, Jen. In the time that you have been advocating, what has been the most significant change that you have seen in VBAC?
Well, I think the fact that more consumers are becoming aware that they have options, and seeing more and more parents switching providers and realizing that you really can't change someone's mind. Either they're on board with VBAC or they're not, and really understanding that no matter what information you bring them, no matter how articulately you explain your position, there's a whole host of non-medical factors that are weighing heavy on the minds of some practitioners. And their stance on VBAC is not based on the evidence. It's based on these other factors. So trying to convince them is really a waste of time. And so I'm seeing more and more parents realize that, and realize that sometimes if you want a VBAC, that means you might have to travel longer distances, particularly in rural areas. But women time and time again report how satisfying it is and how worth it is to make that extra effort to be with a provider who really supports them and is really advocating for them to have the birth that they are seeking.
That's so wonderful to hear, and I too, I love the consumer aspect of all healthcare. I really do. And if we get our consumers to put the demand on the system, then that's when we start to see change as well. So it excites me when I hear the things that are happening in your area, that are, of course, causing this change, that women and families, because we know that it takes a family as well to support a VBAC, are seeing these changes happening. And so I'm excited to hear that you are too seeing that. So one final question for you, Jen, and this is just meant to be just a tiny little sneak peek of what's coming up. But what do we have to look forward to, perhaps even from your presentation, and or what's changing in the field right now that you're excited about?
Well, most recently, we had the $16 million verdict against a hospital for misrepresentation and abuse during labor. And I think that is a very exciting development because, and that ties in brilliantly with my presentation, even though it happened after my presentation was completed. But the idea that hospitals could be sued for abusing women. And this ties in perfectly with forced cesarean surgery. I mean, when you ignore patients, when you ignore consumers, you're opening yourself up to a different kind of legal risk that up to this point has really not been considered. Because the thought has always been, well, as long as mom and baby are alive, then there's no reason for a lawsuit. But now we're seeing a woman who was injured and whose requests were denied, and a hospital who completely misrepresented the kind of care and the tone of their facility. And so hopefully what this will do will enable providers to recognize that patients have rights, and what a patient wants matters. And if you ignore them and if you abuse them, that could open yourself up to legal risk.
Absolutely. I think the changes, as you mentioned in the lawsuit, are phenomenal in our time, and it is another wake-up call for our facilities and our physicians, our healthcare providers, to really reevaluate what is happening, close to home, and how they are relaying messages and what they are saying to our families. Well, thank you so much, Jen. I am so excited that you are here and looking forward to having you coming up soon, teaching us more about the ethics and realities of forced cesarean at our Gold Learning Online Symposium, Childbirth Education. Thanks again, Jen, for being with us here today.
My pleasure. Thanks for having me.
And thanks everyone for listening in. We look forward to having you back again soon. Bye-bye for now.